Hi everybody, it's Jeff Pierce from Michigan Sports and Spine. I think it's week 12. So we're going to start off on a little bit of a sorry note. For those of you who have been following us, I put out a message that a great friend of mine, Jamie Samuelsen from 97.1 The Ticket, passed away over the weekend. And I really want to observe a moment of silence. So we're going to do that now. And in his honor, we're going to have a great show today. So, thank you. All right, so to talk about Jamie for a minute, for those who don't know, he did the morning show on 97.1 with Stoney. And Jamie and I actually started out around the same time, if you can believe it. In 2000, I got my big break to take care of professional athletes. I was the head team doctor for the arena football team, the Fury, that played out of the Palace. And I was the new young physician, and they had the new sports reporter, Jamie Samuelsen. It was one of his first major gigs, major plays for sports. So that's where we got to start. And then actually when I was on 97.1, he always told me I was doing a good job. He would critique me, and him being a professional for so many years, I took it always to the heart. And he said, if you knew Jamie, he didn't mix words. He said it politely, but he gave you direct answers. And that's always something I learned from him. But one funny story, when we were on the Fury, we actually made the playoffs our first year. And we were all excited because we were going to get to use the Pistons plane, because the same owner, Mr. Davidson, owned the Pistons and the Fury. So we were all excited because we thought we were going to get the Piston plane. And for some reason, I don't know if they made the playoffs, but for some reason we didn't get the Piston plane. We ended up doing a Spirit airline flight. And it was the worst experience. Him and I were the last people on the flight. So we're in the back row with one of the other coaches. The other coach is one of the linemen. So if anybody flew Spirit, there's not a whole lot of room. And back then I was a little bit more muscular. Jamie's a thin guy, thank God. He sat in the middle. But the three of us were jammed in the back of the plane saying, boy, we looked at each other, boy, we've really made it now. So from then on, we've always joked about that first time and how we both progressed in our careers, and hopefully we both were considered successful in what we've done. But on a sad note, it's going to force me to be tested. Jamie passed away from colon cancer, and his message to everybody was to get checked. It is easy. I am guilty of not being checked. I should have done it probably 10 years ago. So to vow to my friend, I will go out and be checked, and I encourage all of you to do it also. So enough of that, but truly an unbelievable guy, and anybody who didn't know him, there's a lot of stuff on the internet and messaging, but a true sports reporter, a guy that lived it and breathed it, and I know he's got a wonderful wife and kids, so prayers to them. Okay, I'm gonna not get emotional. So we're gonna jump into the questions, shift gears here kind of quickly. So safe and effective exercises for someone with bad knees is the first question. So basically this is a common thing that goes on. So safe and effective, what we talk about is basically closed chain kinetics. If anybody's been treating with me or knows anything about exercising, there's something called closed chain kinetics. The difference is, the simplest way I can explain that is that your foot is controlled on a flat surface, as opposed to like when you do knee extensions on the machines where your foot is in the weight and you kick it forward. When you're kicking it forward, you're putting your knee at a disadvantage. You're creating a weight bearing to the knee that if it's an injured knee, you're going to create more of a stress on it. So if you do like a leg press where you're actually in the machine, your foot's on that platform and you're pushing the weights up, that's a controlled environment for your knee to exercise. The other things that are simple, if you truly have knee pain, are simple stuff. Just, you want to strengthen up your quadriceps, your thighs. So the quads are the front part and your hamstrings are the back part. So you need to create what we call a 3-to-2 ratio. Your quads, especially if you see hockey players, have those big enormous muscles in the front of their legs. And then they create almost a muscle imbalance, some of the hockey players that don't do cross training, because they're using the front so much more than the hamstrings. So you have to create a good balance with that. So it's a 3-to-2 ratio with that. And the way to strengthen up your quads, sometimes we tell you to do squats, we tell you to hold on to the table depending on your age, where you're going down to a 90 degree or seated position. If you're a big muscular guy, then the whole thing is a little bit different. So with someone with bad knees, we're going to assume that you're already having difficulty. So the other simple thing to do is that when you're laying down on your back, you lift your legs up. Okay, so if these are your legs, you're going to lift it about 2 inches off the ground. If you're in your bed or if you're on the floor, you're going to lift it 2 inches up, but make sure your knees are apart. Because if your knees are together, you're cheating, because it's easier to do, and it's silly, but you can test it yourself. You can put your legs up and hold for 10 seconds and put them apart. You tell me which is tougher. I guarantee it's legs apart. So those are a simple exercise you can do right out of the gate, and then you want to slowly advance. Walking, biking, those are simple exercises. If you do have bad knees in biking, the problem is when you bend your knees. So you raise the seat up a little bit, an inch or two, a little bit higher than normal, so you don't get as much flexion and extension in the knee. Overall, you want to do like the lunges, side lunges, things like that. But again, probably the simplest thing is to do the leg raises while you're laying in bed and pushing for extra activity. So just to go over it again, you're laying on your back, you're lifting your legs up about 2 inches off the ground, you keep your legs separated. You hold it for counts of 10 and you do it 10 times, and then you advance from there. Once that starts feeling better, you start feeling your quads going. You can even walking stairs up and down, that's something simple you could do at home. The weightlifting, if you want to do the weightlifting, again, it's a closed chain kinetic. So your foot has to be flat on a surface and you're pushing the weight out. Don't put the weight on your ankle and kick it up. That's going to put it again at a disadvantage. The other huge thing is to make sure what is wrong with the knee. Okay, so if it continues and it's not responding to over-the-counter anti-inflammatories, ice, heat, or creams, you probably need to come in and be evaluated. Us with our injections and PRP, everybody's seen me push PRP, the knees are definitely responding well to the PRP, the platelet-rich plasma and the stem cell. I do have a story for you with one of my last patients that we'll tell in a little bit. So, number 2, hopefully that answers your question. If not, you probably need to come in and we probably need to do a full evaluation for you. Excuse me. Question 2, what are some of the signs for needing back surgery? When the pain is radiating down through the legs? So, back surgery is a big deal. Our whole thing at Michigan Sports and Spine is we're here to keep you from surgery, but we won't keep you from surgery if you need it. So some of the signs, some of the emergency signs is the easiest one is loss of bowel and bladder. That's an emergency sign. That's exactly what you need to run to. The other thing is if you've lost full use of your leg, if it feels like your leg just turned to rubber, then that's another big sign. If your leg starts creating atrophy, if you have continuous pain and discomfort, that's not necessarily a sign that you need surgery. It's how easy it is to reproduce it on our examination, what we need to do. Like what I tell people, especially with the telemedicine, and we're not able to examine people, a common maneuver that we do is I have you sit in a chair with a straight back, sit up nice and straight, put your shoulders back and lift your leg up. And then if you lift your leg up and you reproduce the pain down the leg, that's a problem. If you bring your toes to your nose, bringing your toes up, if the pain shoots down, that's another problem. Okay, so those are the signs that we'll look for. It doesn't mean you need surgery right away. It means that you may be a candidate. We need to have an aggressive program put together. So usually, one of the issues for surgery is if you still have these symptoms, you've gone through a very good structured program, which will include, home exercises, medications, therapy, and then possible injections. If you fail all that, then that's another indicator for potential surgery. But again, you should be someone that you're confident with and competent to go ahead and make those decisions. So here, if you're a patient here, we put you through the program, and if you're not doing well, if you fail the program, if we just can't get it to stop, then we're going to get you with a surgeon that I feel matches your personality and your needs. So, we have a lot of individuals that we use in the area that, from my perspective, are very good at what they do and have already been, not say vented out, but they've gone through where I have confidence in what they're doing by sending them patients that I would recommend them. So when it says radiating pain through the leg, that's more of an indicator, so we worry about that. So hopefully that answers your question. But again, our goal is to keep you from surgery, but if you need it, we'll definitely find someone for you. So another thing that happens, just came to mind, is that if there's a bone spur, so if this is your spine, again, which my friendly spine, with my buddy behind me, this is the front, this is the back, this is the bone, this is the disc. These are the nerves. Sometimes we'll get a bony spur sitting in the wrong spot. Then no matter what I do, we have to have that removed. So when there's bony problems, then that's more of an indicator that you may need surgery. And now with surgery, everybody's convinced less is more. So we're just going out and taking that area out. We're not taking away big pieces anymore. We're taking out what's aggravating, and we're trying to expand so we get the height back. Okay, and that's where a lot of the stem cells coming in, is to get that growth of height back into the disc. Because if this disc starts collapsing, it collapses the opening where the nerve is. If the nerve gets collapsed, then that's where your real problem is. So there's disc disease, but there's also the nerve issue. Okay, so that all has to be addressed. So you need somebody that's comfortable addressing all those issues. So that hopefully more extensive answer. So question 3 is from an athlete. So the simple thing goes back to ice or heat. So there's been a debate that recently came out, and I don't forget what journal published it, but they said there's controversy in ice. Okay, so and in some ways, when I start talking about PRP, platelet-rich plasma, what does it do? It creates a cascade, a healing cascade. So and part of that healing cascade is inflammation. So we want to cause an inflammatory response locally, so the special cells in your blood come and start attacking it and healing it. So there's an inflammation, then there's a healing process coming from your body, because your body is your best natural healer. And what happens is these products in your bloodstream come and create a healing cascade. So they start healing the tendon or the ligaments or your heart or anything. That's what the body does. It's a self-healing mechanism. So what they're saying is by putting ice on is that you're killing the natural inflammatory response, because we want to cut down the inflammation so there's healing right away. So in my practice, in my mind, there's still debate. Do I still use ice? Absolutely. I do. I ice. When I injure myself, the first thing I do is I ice. I feel so much better within 24 hours. I recently just hurt my thumb. I iced it. I would have been miserable, but within 24 hours, I'm still, I'm doing a lot better. So I'm still of old school, understanding the new school and what they're trying to say, but I feel that there's some of the things that are being left out. Ice, you want to control the inflammation. From the cellular level down to the bloodstream and the cellular level, there's an inflammatory process to create the cascade. I don't feel the ice is hindering that process. So it's not like you sit in an ice bath for 20 to 30 minutes. It's that initial ice at the local level to control it, so there's proper treatment. So the overall answer is ice is good. And what I tell people mostly is, if you think of a baseball pitcher, the baseball pitcher, before he gets ready, he's got to warm up, he's got to stretch out his body, so he wants to heat it up. So sometimes they'll use creams or massages and things just to get the blood flowing and going. After he's aggravated the whole game, his 70 to 90 pitches, sometimes 110, his arm gets ice bagged. You'll see pitchers doing post game. You'll see any players having the ice bags. Chelios used to be one of the biggest guys. He used to just jump in a whirlpool of ice after every game. It resets. It cuts down the inflammation. It cuts down the healing. One of these guys are beaten up. They've been hit multiple times. It just helps the body heal. The other big thing with ice and healing is my fellow, I don't know, for those who know, Dr. Korg, he was in a real bad motor vehicle accident. Well, what he did in the first 24 hours is that he went to the cryotherapy places. And that means it just kind of freezes your whole body in a quick form, and it actually resets and actually can help. So there's still a major role for ice, and it's not that I'm telling you for every car accident you're running to that, but there's definitely a benefit to it. So if that didn't answer your question, let me know, and I'll try to answer it more completely. Fourth question, what's your favorite memory from the radio show? So before I do that, I want to make sure we get to what I want to talk about with my last patient, which isn't a question on here that was called in. It was from my last patient. So I've talked a lot about PRP and stem cell. So this is another great example. He's a 22-year-old kid. He's basically working hard. He's not a laborer. He's a contractor. So he's always working. He hurt his back a couple of years ago. Basically having problems all the way up. Didn't want to do medication. Didn't want to do the typical steroid injections. We ended up doing a platelet-rich plasma in his spine, in the joints of his spine. I talked to him today 3.5 weeks later. He's like, I've never felt better. Same thing with one of my other patients. Again, with the SI joint, we're doing a lot more PRP for the spine and the joints. The SI joint is where the pelvis and the tailbone come together. So those are areas that are definitely benefiting from the PRP. So, shout out to him that he's doing great. He's actually feeling better. He's starting lifting again. His work he's just getting through his day easier. He almost didn't realize how much discomfort he was in until he's getting rid of it. He's just, everything just seems better. His energy's better. He was a very positive kid to begin with, but, I keep calling him a kid. He's a young man. But basically, he's definitely feeling better. So for you, the messaging out there, with platelet-rich plasma, I think there's so many uses for it, and it's not like the wonder drug. It's not a one and out like we initially thought. It's a series of injections that we're seeing now that we're doing every 2 to 3 months, and we're getting a cumulative effect, and we're actually getting regenerative properties. We're getting healing instead of, with steroids, it cuts down the inflammation, but it's really great for the joint and the ligaments. And technically, historically, no, and you can't do an abundance of them. With PRP, we can do an abundance of them, and we're starting to do them more frequently. So hopefully that sheds some light on what we're doing with the platelet-rich plasma, but we're starting to expand from the hips and the knees, and we're doing it more in the spine, and we're definitely getting great results. Okay, back to question 4. I'm not sure who asked this, but in Jamie's honor, what's our favorite memory from the radio show? To be honest, for those who didn't get to watch it, it's on our website. You can actually tune in and watch and make fun of us. But it was actually the beginning with the anxiety of it all, that I was so nervous to get on there. The funny thing is I would prep and write stuff down. I had a legal sheet of paper of what I'm going to go over and everything I wanted to cover. And I did it for the first 2 weeks. And I was there an hour before the show, and the guys who did the show before me. It's like, what are you doing here so early? And it really matured to where I was racing to get there minutes before, and talking off the cuff is probably the best I do. And that's what I do with this show, which is really a prelude to why we do Facebook Live, is that my abilities to what we did on the radio show. We did do Facebook Lives a handful of times. But some of the best memories are related to the people that I had on. We really, we did some great things, I felt. We brought awareness to a lot of charities. The format of the show was about, we would bring on one of my friends that was an athlete or someone special in the community or in the society, and then we always honored a charity for the month. And hearing the stories, I learned a ton, especially, we hit hard subjects. It wasn't just, you think of the easy stuff. You think of the homeless and the people that aren't eating, but there's emotional, there's so many subjects that were hard to touch on, that we shedded light to, that, it was felt like we were making a difference. So when you ask me what my best memories were, it was for us to have a platform for people that necessarily didn't have a voice, and we were able to give them a voice. They couldn't afford the radio show. They couldn't afford things for the awareness, and there's a lot of people that are hurting, and I don't want to get into the emotional part of it, But if you go back and watch some of the shows, I mean, we did some great things. You know, we had the Ted Lindsay Foundation with autism, what he did and how great he was. You know, McCarty coming on. You know, we did we just made awareness and things we talked about with PRP and stem cell storage and just, you know, kind of getting our voice out there. You know, I don't realize I'm saying about too many times, but when I talk off the cuff, it's just information I have that, you know, it's not preset. It wasn't, I read this article. It's what is really going on in the society, and I feel like I've touched on that multiple times. So, you know, I don't think I'm answering your question. There wasn't one favorite moment. I love being on the radio. That's kind of why we're stimulating the show again here. And I think we're going to be able to do great things with this. That's why we'd love to have a bigger following. We want to get podcasts. We're talking about getting our charities back on, which is another plug for me. Our golf outing is on Monday, August 10th. I'm wearing last year's shirt. You can see our Athletes Unlimited. I'm actually very proud that we started this. My family is very, you know, they've adopted it. My kids have grown up through it. It's our 24th year of doing it. My oldest is 20 years old, so all my kids were born through this, and they just have a special part of what we do there. So I'm not going to get emotional, but anybody who can support the outing, wants to golf, we still have openings. It's Monday, it's Oak Point at 9:30. It's going to open at 11 o'clock. We're obviously going to be doing it a little bit differently because of COVID. Normally we have 260 people, 300 people for dinner, and we're able to send the message from our disabled athletes. So I'm getting emotional again. So on that note, I mean, these are unbelievable people that motivate myself. They're the ones that are in wheelchairs and spinal cord injuries and keep a smile on their face. And one of our little guys is amazing, and he's inspiring to everybody. I brought him to a KISS concert, and he took over the concert. It was crazy. It's true, but it's crazy. But what's going on now is that we're keep pushing for that. So I know we're running overtime. It says, can you tell us about the hardest case you've had? Probably the hardest case I had is a little different. You probably will be surprised. I had a 13-year-old young athlete. He wanted to be an inspiring hockey player. And he was Red Wings. And this is back where the Red Wings were winning Stanley Cups and, you know, the days of Yzerman and Fedorov and Draper, McCarty, the grind line, all my buddies. So he came to me especially because I was working with the Red Wings. And what happened is he was working with a chiropractor that had the smarts that something didn't feel right in his neck. And he took an x-ray. And he was born actually with his second vertebral body. So again, it's your spine, it's your vertebral bodies here. It's the second one. So you go from your skull, you count 1, 2. So what happened is he was born with half of the bony part not there. And I've always prided myself that I always get you to the sport you love, and that's what I was promoting back then, and, you know, we'll get you to play. And this chiropractor had the smarts to send him out to someone else. They found me, and I had to tell that kid that because of the instability of his spine, that a contact sport wasn't going to work. And it was like I crushed his dreams. You know, his dream was to be Stevie Yzerman, and it was very hard. His parents were there, so from an emotional standpoint, that was probably the hardest case. So I think Jamie has made me emotional today. So we're not going to get to our last question, but I will try to get to it next time. But again, the golf outing's on Monday for any of you that are going to support it. Jamie's message: go get tested. GI, it's a simple test. It's an uncomfortable test. Getting scoped, men, women especially, they think they're immune to it. That's more of a man's problem. It's not. Here's a very sad case that had to prove to us that it's very important to get tested. And if I can, at least one person go out and get tested, then we've made a difference. So in summary, the root of the problems are proper. So when you're talking about knee pain, you're talking about back pain, get to a confident physician that knows what he's doing. Make sure he's got a confident team working behind him. He needs that. It's a whole team approach for all these issues. It's not like I always say, they make fun of me. It's not like a rose where you just pulled the thorn out and you fixed it. It's usually a complicated issue where you need a team approach. Um, modify your workouts until, don't stop working out. You modify your workout and continue. Staying still is, every day you stop, you need 3 to 5 days to get better. And cherish the moment.